We'll begin our flexibility portion of flat back posture. We're going to take all of our equipment, setting it to the side, and moving to a wall for a deep calf stretch. Facing the wall, stepping 1 foot back, looking over your shoulder, making sure that that leg is parallel. The foot is parallel. We'll drive the hips forward as we drive the heel down, bracing the abdominals, keeping the tailbone reaching back for a little lumbar extension. The calves, especially the gastrocnemius, the center of the calf, is very tight with flat back posture. So we spend a full minute releasing this tight area. We'll do a minor adjustment, internally rotating this leg in the hip socket so we get into the outer calf as well as the gastrocnemius. You'll notice the outer calf, your peroneal stretching now. We've still got a deep bend in the front knee, equal pressure between the heel and the metatarsals of the front foot so the knee tracks safely. The abs are pulling in and up. The hips are pressing forward towards the wall in front of you. Take your focus up, eye level. Plug the shoulders down your back. Collarbone is wide. 30 more seconds here. If this stretch doesn't feel as tight as having your leg parallel, you can revisit the parallel position on the same side. Play around with where you feel the most stretch. So it may be with that internal rotation and it may be parallel. 10 more seconds here, lifting in and up on the muscles that stop your stream of pee, and as you exhale, driving the heel down and the pelvis forward. Go ahead and switch sides, setting up with your feet hip distance apart, stepping the opposite leg back, taking a moment to look over your shoulder and make sure that leg, foot are perfectly parallel as we begin our gastrocnemius stretch, driving the pelvis forward and the heel down on our exhale, making sure there's equal weight in that front foot so the knee tracks safely. Feel the inner and outer edge of the foot, the metatarsals, and the heel grounding into the floor. Inhale through your nose, pull your abdomen in, drive the heel down as the pelvis drives forward. You're doing great. Getting a nice stretch for that central calf muscle. We did a lot of good work in our cardio burst today, and we want to make sure we stretch out those muscles to lengthen the body. 10 more seconds here. Breathing into the gastric stretch, driving the pelvis forward and the heel down. We're going to readjust, moving into our peroneal stretch on this side, internally rotating the leg from the top of the hip socket so you can actually take your pointer finger to the bony protrusion of the hip of the leg you have back and guide it inward so that the rotation is not happening from the knee or ankle, but from the hip socket. From there, pelvis presses forward, focus of eyes is up eye level, sternum is reaching towards the back body, shoulders are plugged down the back. You've got a nice right angle with your front foot because you're bending into it with your front leg. Just make sure the knee isn't tracking beyond the metatarsals, that it's tracking right over the second and third toe. Inhale, abs come in, lift up on the muscles that stop your stream of pee and drive the hips forward and the heel down at the same time, exhaling the air out. Connecting with deep abdominal contractions will allow you to condition the deepest layer of your core to alleviate low back pain while maximizing your time and stretching out your tight postural muscles. One more breath. We'll move into a T-pec stretch, wall stretch. You're going to bring one arm out to a T, soft bend in the knees, starting to twist away from that arm. In our warm-up before our cardio burst, we opened up the pec minor and the anterior delts and bicep, and now we're getting into the pec major, all of which are active due to the kyphosis and the forward position we are in our seated posture and the rounding in the shoulders that happens from computer work, office work. You've got about 10 more seconds here. Inhale, brace the abs, rotate a little deeper on the exhale. Again, inhale laterally, pull the abs in, lift up on the muscles that stop your stream of pee, and fog a mirror as you twist deeper. Let's move to the other side, setting up, facing the wall, soft bend in the knees, begin your rotation. Twisting away from the arm, looking away from the arm. Notice if the chin is poking forward. Retract your chin, engage the neck flexors. Reach the sternum towards the back body, and now focus on the deep abdominal contractions. Inhale, pull the abs in, lift in and up on those muscles that stop your stream of pee, brace, and exhale, twist. Inhale, abs in, lift in and up on those muscles that stop your stream of pee, brace them, and exhale, twist. One more time, lateral breath, abs in, hold those muscles in and up, and fog a mirror as you deepen your twist. We're going to move to a lat release with the foam roller sideline. You can grab your ball to place on your bicep to rest your head down on. This usually feels nice. Some people think it's a little high and it doesn't feel good to the neck. If that is you, then grab a pillow. That might be more comfortable. From here, you can play with the leverage of lifting the pelvis up by bending one knee and having the foot down so that you have more weight as you roll forward and back, getting into the fascia under the armpit where the lat attaches. You can also play with twisting the torso forward and back. Typically, I find that my flat back posture clients feel most of the release when they twist back. So it's a posterior area and where the lat attaches and the fascia you're working that's typically very, very tight. So play around with the angle, play around with moving forward and back. And once you find tender areas, really dig in as much as you can tolerate. Self-myofascial release is to stimulate the Golgi tendon organ, and this sends a neuromuscular message back, releasing muscles that are tight. It's a great way to get more range of motion and improve your posture. All right, let's switch sides. Moving to the other lat, setting up, supporting the head, tuck your chin, keep the front of the neck engaged. Even in this sideline position, we should be bracing our abs. Our tailbone should be reaching away. We should find lumbar extension and that optimal position for our pelvis to alleviate chronic back pain. Keep using your abs to move yourself forward and back. Be aware of any knots that you come across. You can do a little circular motion, digging the body into the roller. Again, as I said, with flat back posture, twisting back, you'll probably find some very tight fascia. Work through that, breathing. Inhale, abs in, brace, and roll that fascia out. Again, inhale, abs in, lift in and up on the muscles that stop your stream of pee, and fog a mirror as you roll that tight area out. From here, we'll come to a seated position. Placing one leg on the roller, we'll roll out the calves and the hamstrings unilaterally. So one leg at a time. Using our hands behind us, we'll have to engage our back. Fingertips can face the buttocks or out to the side. Keep a soft bend in the elbow. If this is too intense, you can always put your other foot down, or you can roll both legs together. Only you know what you can tolerate. Remember, this is meant to not be comfortable because we are working out knots in the body. But if at any point it feels unbearable, you need to modify. Put one foot down. Don't put as much pressure. Put both legs on. That takes a lot of the pressure off. Unilateral rolling is more intense than double leg rolling. We only have 5 more seconds here and then we'll switch. So we're rolling out the calf. And then option to go up to the hamstring if you want to get into that fascia. Go ahead and switch sides. Playing around with getting into the calf fascia and also getting into the hamstring. It's nice to engage the upper back here as you're walking forward and back. You get a nice workout. It's a modified reverse bridge, which is meant to engage the center of the back, the triceps, and when the feet are down, the glutes. So breathe here, working on releasing those calves and hamstrings, those overactive calves and hamstrings. Couple more breaths, keeping the abs braced, the tailbone reaching back, the arms active, soft bend in the elbows. Find your final spot, take a deep breath, inhale, abs in, lift in and up on those muscles that stop your stream of pee, and fog a mirror with your exhale. From here, we're going to lie supine, placing the ball under our head and grabbing our heaviest Theraband. Placing it around the arch of the foot. We'll keep our other foot down on the floor. Actually, let's keep it down on the floor. I want you to find lumbar extension, reaching the tailbone towards the feet, creating that mouse hole between your low back and the floor, dorsiflexed foot. We're doing our final stretch for the hamstrings and calves here, really flexing the foot, breathing into that stretch. Deep inhale and exhale. Good, inhale and exhale. One more time, inhale and exhale. Go ahead and switch sides. Setting up. Dorsiflexing the foot, reaching the tailbone away towards the feet, creating that mouse hole. Sternum reaching towards the back body, collarbone wide, chin retracted. Maximize this stretch here. Really flex the foot, squeeze the front of the quadricep. So when we did our hamstring and footwork lying with the ball under our sacrum, it was easier to keep the extension in the low back. Here, you really have to bring awareness to what's happening, making sure you're not flattening the low back into the floor, putting pressure on the lumbar. We want to create that space. So every time you exhale and pull the leg closer, you have to remind yourself that tailbone needs to reach away from me. I need to keep that low back arched without pushing the belly out. So brace those abs as you do this. We'll end with a psoas release, taking the ball and slipping it under the tailbone. Point your fingers to the bony protrusions of the hips. Exhale, bracing the abs, moving the pelvis into extension, arching. From here, one hand down on the floor, one hand grabs your shin, and the other leg straightens out. Inhale one, breathe, squeezing the front of the thigh, making sure the foot is on the ground, not lifted up in the air. We're opening up the hip flexor after all that cardio burst work with the light loop band loading, engaging those hip flexors. Inhale and exhale. One more breath here. Inhale and exhale. Let's switch sides. Setting up on the other side. Bringing the knee to the chest. Tailbone reaching away. Finding that lumbar extension. Inhale one, breathe. Exhale one. Inhale two. Exhale two. Inhale three, sternum reaching towards the back body. Exhale three. And go ahead and bring both feet to the ground. Point your fingers to the bony protrusions of your hips. Give me 2 extension to neutral pelvis movements. So exhale to extension. Brace the abs. Inhale back to neutral. Exhale to extension. Inhale back to neutral. And now tick-tock the hips side to side, going to 9 o'clock, center, to 3 o'clock, center, and 9 o'clock, center, and 3 o'clock, center. Isolating that pelvic movement, and 9, center, exhale, 3, inhale, center, exhale, 9, inhale, center, and last time, exhale, 3, center. Great job.